Welcome to Wide World of News. I'm Mark Halpern. We're talking today about an industry that has had its troubles in terms of public relations over the last few years, but is now front and center in this war against the virus. The pharmaceutical industry has its ups and downs in terms of its relationship to the American people and to government, but right now it is front and center, and there's a lot of interest, obviously, in what the industry is able to do regarding coming up with treatment and a vaccine that would change the contours of the challenges we face. We're talking today to a man who wrote a Wall Street Journal op-ed piece this week that I think was one of the best ideas I've heard about how to deal with this crisis. It was innovative and it was bold. Safi Bahcall is a man who has a lot of credentials. He's been a biotech entrepreneur. He's a physicist, a CEO of a big company, and also an outside advisor to the Obama administration on science. And all authors like to have their books plugged. The author of a book that came out last year called Loon Shots, and there it is, available now where you buy your books. Safi Bahcall, welcome. Thank you for joining us.
Thanks for having me, Mark.
Your piece made two big points, both of which I think are incredibly important, and I hope to use this conversation to strike a spark to get people not only talking about it, but hopefully doing it. I'll say what the 2 points are, and then I want to talk to you about both of them and how you see the problem and then what your solution is. One is to have the pharmaceutical companies, which are cooperating now to an I think, unprecedented degree to try to share information and to come up with solutions in the labs to the two big problems of both treatment and a vaccine. And then second is there's an absence of information every day, clear information about how the progress is going in the labs. And your proposal is to have a daily briefing that's science-oriented, that gives the American people and the world an update on where things stand. So I think those ideas are great. Let's talk first about the level of cooperation. You write in the piece that you've been involved in a lot of conference calls and discussions with people in the pharmaceutical industry. What is the state of cooperation now, and where is it falling short?
I think anyone who's worked in the industry, and I've been in the industry maybe 20 or so years, has just been stunned. You see on one Zoom gallery, on one call, sworn competitors talking to each other, kind of nervous because they've never been together before, but with just one goal. How do we accelerate a cure or a vaccine? So the level of cooperation, friends and colleagues talk about sending an email and getting what would otherwise be proprietary confidential data back in 10 seconds from their competitor. Back and forth, back and forth. So that is good news. The progress that the industry has made is stunning. If you've ever worked in this industry, you know that it takes years to get something into human clinical trials. We have now 200 drugs in development, of which 50 have already started clinical trials, and that's less than 4 months from sequencing the virus. And we have 9 vaccines already in clinical development, with another about 100 coming right behind that. That pace has never been seen before.
And how much of that pace is attributable to the unprecedented cooperation between them?
I would say not all of it, because you have 1,000 flowers blooming, lots of little biotech companies, rushing into the clinic. But some of them are cross-industry collaborations that are happening at a scale that no one has ever seen before. Normally you're surrounded by a phalanx of lawyers before you can get anything done, and it takes months to sort through. Here you have 2 people on a call talking and starting working together 10 minutes after they hang up the phone without any lawyers.
They've put aside the lawyers, they've put aside the normal premium they put on in a proprietary way developing a product that they could make money on. Are they assuming none of them are going to make money? Is that completely out of the equation, or they just set that aside for now?
There's essentially no hope for profit on this stuff. And you read, if you're outside the industry, it just seems, if you're reading what's being written or talked about outside the industry, it reads like, science fiction. Oh, they're profiteering. You can't make money off a drug that will be gone in a year or two for disease. So once you have a vaccine or once you have herd immunity, there won't be any drugs that'll be used for it, or very few. And especially when you have 300 drugs out there. So, yelling at oh, they're going to profiteer, yelling at pharma companies, oh, they're profiteering, is like, imagine you have a big farm that's churning out, produce and stuff people are buying. And then you go yell at them because somebody put up a lemonade stand for a summer, right? The numbers don't even add up. Pfizer, Janssen, their sales are tens of billions.
Right.
You can barely make any profit off any of it. It just doesn't even make any sense. So no, they're doing it because this is the time. This is the time. Firstly, all of them are personally affected.
Right.
Secondly, they are living in the real world business economy. So when everything shuts down, everybody hurts. And
Right.
third, it's a time to come together. Civic duty is more important than individual company needs. And everyone I've talked to, that's what they're thinking.
So in the piece, you argue, as I said, that while their level of cooperation is unprecedented now, that there needs to be more. Which areas do there need to be more cooperation in, and how can that come about?
Well, I'll give you an example. It's easy to recognize that something is very different today than 4 months ago, but it's not so easy to completely shift mindset. I'll give you an example. If you were in charge of running a clinical program, running at a company, a research lab, you want to advance your own drugs, your own projects,
Right.
your own baby. It's just like if you've got a high school basketball team, you're rooting for your basketball players, not the other guys. Well, that's normal course of business. And in normal course of business, it's a competition. You might have 5 companies developing 5 more or less comparable drugs, and they all launch them and they all compete, and you see who wins. We don't have that luxury. That's peacetime drug development. We're in wartime. There are a lot of things that change that are different between peacetime and wartime. This is one of them. You have to make sacrifice. You need to come together and say, listen, we just do not have the bandwidth as a nation to run 5 copies of 5 identical drugs in 5 similar trials. 4 people have got to sit down and take one for the team.
Can the government get involved, or could they form a committee of the CEOs? What would it take to cause that, given that they're talking to each other all the time?
It could happen. There are only 2 ways that happens. The CEOs get together and agree, all right, we're going to make a decision. We're going to empower a cross-company group, a committee to pick so we avoid wasteful redundancies in the system. Right. Or the federal government will do it for them. So that, this happened with the motion picture industry. You might remember decades ago with the laws about what you can say and profanity and how much nudity. Well, the federal government was about to step in, and the motion picture industry said, gee, I think it might be better if we did it ourselves rather than have the federal government do it for us. So they created, the Motion Picture Academy that, self-polices. It puts on the motion picture ratings we all see. This is what the pharma industry needs to do. It said, look, either the federal government is going to do it or we're going to do it. It's going to be A or B. And it's a lot better if we do it ourselves.
I want to ask you one more question about this and then move on to your other great big idea. This is not just American companies, though, right? This is companies around the world.
Right. But the biggest companies are global. Let's say AstraZeneca or GlaxoSmithKline that are based in Europe. At least half their sales are in the United States. So it's a
but when you say the government's going to do it, the U.S. government wouldn't necessarily have sway over companies that weren't U.S. companies, right?
Correct. But in drug development, you run clinical trials in hospitals, and the biggest hospital system and the best clinical trials are still done in the United States.
Got it.
So those are under the purview of the federal government or state governments.
So your other big idea is the notion of a daily briefing, so people have an idea of where we stand on any given day. I read widely about this, and obviously I'm as interested in this as anyone, because it's clear that until we have these drugs and a vaccine, we're going to be in a much worse and different place, basically, filling time until we have them. So how do you envision a daily briefing working? What purpose do you see it serving?
Right now, with the internet, with the cable networks, we have bad science screaming loudly. And when bad science screams loudly and good science stays quiet, everybody loses. It's a public confidence measure. We've all understood that. If you look back in history, and I spent a lot of time understanding the history of mobilizing scientists in World War II, public opinion matters. Public confidence matters. Just like in bank runs, it's a matter of public confidence and public opinion. And now we're talking about a science problem, a medical problem, not a bank problem or a fiscal problem. And what matters to restore public confidence is good science. I am optimistic about the science for many reasons, that it get lost in the shuffle. This is a dumb virus. It hides out in your blood and goes attack somebody else. It doesn't go deep into your immune system like HIV, which is a really smart and difficult virus. It's a really straightforward virus. That's very good. Very good news for vaccines, for drugs that kill the virus. It's in plain sight. It's a very simple binding mechanism. We've seen it before. That's good news. It's not getting out there. It's getting drowned in bad science. We have these 200 drugs and 100 vaccines in clinical trials. It's a phenomenal shots on goal game. You only need a few of them, and the likelihood that a few of them will work is extraordinarily high. Things are moving a lot faster than people expect and understand. All of those reasons are reason I'm optimistic, reasons many of us who have worked in drug development and drug discovery and in the science behind this kind of disease are optimistic, but it's not getting out there. A science daily briefing could go a long way in restoring public trust, public confidence, and understanding that we're going to win this war with science and innovation, not by talking this virus to death or complaining about who did what. We will win with science and innovation.
Right. And as you say in the piece, this can't be a government official because they're not going to be able to talk as fluidly or as freely about what's going on in the private sector as someone from the private sector. So do you envision this being someone from one of the big companies?
No, it has to be independent. There are a lot of reasons that a company representative can't sit there and talk about the pipeline of 300 drugs that are in development.
Right.
One company representative, first of all, will have conflicts. Second of all, because almost all those companies are publicly traded, they're very restricted and very cautious about what they can say publicly without getting sued by SEC lawyers. And third, you need somebody to do this full time. You need somebody who sits there for an hour or 2 hours every single day and answers every question that any credible journalist or any credible author or any credible media figure wants to know, or any governor or any local official needs to know, and answers it with authority and credibility. It has to be every day. Hiring a team like that is a few $100,000 and maybe even a few $1 million, but we're talking trillions of dollars at stake.
Right.
It's an extremely high return on investment.
Yeah. After I read your piece, and I just think it's such an important idea for not just the country, but for the world, for someone to put that out. I thought, who could do it? So far, the only person I've come up with is you.
There are lots of people who can do it. The important thing is to have someone, not just who's a bureaucrat or an administrator. I mean, there are a lot of very talented people who are national treasures at, let's say, even the FDA, which gets completely unfairly attacked. There are people who are doing an unbelievable job responding incredibly quickly at the FDA. And I know, and many of us in industry see that every day. You want someone who has scientific understanding, who can explain the basic science of it. People are very curious with credibility, but someone who's worked in industry who understands that the challenge isn't just, where is the binding protein live on the virus? That's an interesting academic question. But here's a real problem. How do we make 1 gram of product, which is what you typically have for laboratory studies in universities, into hundreds of thousands of kilograms? That's a really big challenge. So where are we? What's it going to look like? What's the timelines? When are we going to get an update? So what you want is somebody who's been both in industry and has strong academic credibility. There's a lot of people like those. But key to making that work is you've got to have the industry CEOs and leaders come together and have some courage.
Right.
You have that game theory vicious cycle. The first one who sticks his neck out might get it chopped off for whatever reason. People like to be critical. But it's the right thing to do for the common good. They need to come together and say, listen, we need a science daily briefing. This is our one chance to really restore the prestige and reputation the scientists working in the nation's industrial research labs deserve. There's tens of thousands of scientists busting their butts 7 days a week to try to come up with vaccines and cures and move them forward and manufacture them. People don't know. This is the one time. It's an incredibly rare opportunity to get this right. So form a team. Won't take more than 5 or 6 people. It's not that expensive compared to the trillions of dollars that are at stake. You will uplift a nation. You will uplift the world. You'll restore confidence in science. It takes 5 or 6 people to do a science daily briefing. So as you can see, I'm a little passionate about that. This is our time to restore confidence in science, which is what's going to win this war. So let's get it done.
Yeah, I mean, I see why you're passionate about it, because from the minute I read your piece, and I recommend everybody go to the Wall Street Journal website and read the piece, the minute I read it, I was pumped up about it, because so many ideas out there that are either impossible to produce, to get done, or you're never gonna have consensus, or they're too expensive or complicated. These are, like a lot of great ideas, really simple and vital at this time for the industry, for the world. And I really appreciate you coming up with them, and I appreciate you taking some time to talk to us about them today. Safib Akkal is a physicist and someone very familiar with the pharmaceutical industry and fighting disease, and he's also known around his house as the author of that great book right behind him, Loonshots. Thank you very much for joining us.
Thanks for having me, Mark.
I'm Mark Halperin. Thanks for watching Wide World of News. We'll be back with more conversations in the coming days. See you then.